Hello, and welcome to this session on digital health equity. We are very excited to have you here and hope to share details for crucial healthcare topic that we are very passionate about. We hope you find this informational and useful. I am Suna Daraja and I lead the global database services for AWS Public Sector. Since I was 12, I've been looking for ways to leverage data to make life easier, mostly by using computers. This drove me to learn to code in over 12 programming languages, yes, 12, and I started my career off as a software developer. Now it gives me immense pleasure to be here talking about using technology and data for global health equity. And I feel even more privileged to be here with one of the most progressive minds I know of in the healthcare industry, Dr. Ashish Atreja, the CIO and the Chief Digital Health Officer at University of California, Davis Health. He also likes to be known as the App Doctor. He's going to explain why, and you will know why in a bit. I'm now going to pass the baton to Dr. Atreja.
Thank you so much, Sue. Hi, everyone. It's a pleasure to be here. I'm Ashish Atreja, CIO and Chief Digital Health Officer at UC Davis. And I consider my stay at UC Davis as my fourth career life. I started off as a physician. I'm a gastroenterologist by background. And then I moved on to informatics. Yes, the physicians do get a fellowship now in IT and informatics. But I quickly realized most of the informatics and IT in healthcare has been focused on provider-centered care and not patient-centered care. And really what we need today is patient-centered care. So I evolved into a Chief Innovation Officer role where the goal was to build new technologies, digital health, completely to help us transition to a patient-centered care. And now at UC Davis Health, my goal is to take all those technologies that have been developed and are developing right now to a large-scale transformation that no single patient, no single clinician, no single researcher gets left behind. And a lot of that has to do with the infrastructure that's set up in the cloud. So at UC Davis Health, it's one of the premier academic centers in California. We cover a wide area around 33 counties in California, all the way from West Coast to Utah, from San Francisco to Portland. That's the area we cover. And that's why we've been using telehealth since 1992. We're considered the fourth most diverse medical school in the country and the top 10 medical school in primary care. We have a number one ranked vet school, and we are big on food and health. I want to focus my talk on the next big wave in healthcare that we see powered by exponential technologies. During COVID, many of you have witnessed the transition from in-person care to virtual care, where you can actually get a video visit with a physician without going to a physician or without going to a hospital. And that has been transformational. So this graph shows how the percentage of telehealth visits have been before and how much that sprang, where telehealth became, the video visits became the main mode of delivering care virtually. And even now, we are seeing a substantial number of our patient visits which are happening virtually. So some of that trend is gonna stay. But what telemedicine did was completely unlock the space dimension. Since medicine has come to being in modern world, the only way to deliver medical care has been to be in the same space as a clinician, as a physician. But with video visits, that space aspect was unlocked, and you can be anywhere in the world, and as far as you have good connection to internet, we can see a video visit. But what telemedicine has not done, has not unlocked the time dimension. You still need a physician on the other end to take care of you. And we as physicians, we as clinicians, really are limited in our resource and capacity, and that's where a lot of the gap that happened. Today, it's not that much about the science of medicine, because the science of medicine can today control 95% of hypertensive patients very easily. The gap is delivery of care. So in spite of the fact we have medicines which can control 95% of hypertensive patients, only 1 in 4 patients with blood pressure are controlled because we have limited resources to to guide the patients. And that's where digital health can come. Digital health can create digital avatars of us clinicians using automated machine learning algorithms and AI, and can deliver exponential delivery, which has never been possible before. We can unlock the time dimension. That's where the Moore's law will really come to healthcare. And to quote an example, many of you are familiar, human mind only thinks of linear. But really this Moore's law, these technologies in digital world, in data science, is exponential. And the story goes, there was a farmer who really impressed the king, and the king asked, ask me anything that you want. And the farmer said, all I want is grains of rice, which doubles every single square of the chess. What the king did not realize, that leads to 10 raised to the power 18 or 10 quintillion rice grains, which was 50 times the world's production of rice. So technologies which are exponential seem very, very small when they start off, very much like digital care is doing right now. But when it starts few years down the ride, they really change the whole aspect, and it's been unimaginable since then. But what exactly is this exponential digital care? These apps and digital therapeutics, I'm going to cite examples, really allow moving us from one-to-one care, whether it is physical or virtual, to one-to-many care. If we create an algorithm that can go to millions and billions of patients, right? But that cannot happen in a physical world. If you look at decentralized clinical trials, if you look at secure messaging algorithms, augmented reality, chatbots, Alexa, wearable and IoT, these are all scalable technologies which can go beyond one-to-one visits, whether they are physical or video, to one-to-many care. And I'll cite some examples about that. There was a very interesting study done in Australia and published in JAMA, where patients who had heart disease were counseled to decrease their intake of salt, cholesterol, and how to counter the smoking habits. Now, in a traditional world, that would have happened through a physician or a nurse sitting with the patient one by one. But what they did, they created a text messaging algorithm where automatically the patients were given text messages about why they need to stop smoking, why they need to control the salt, and then how they can do it. And over 6 months, they found 61% reduction in number of patients who were smoking, reduction in weight, reduction in blood pressure, but completely automated. So now this program, once it's proven to be effective, can actually be scaled across Australia. And not only across Australia, because it's the same human behavior across the world, it can be scaled across the world, which otherwise in a one-to-one care manner, this would never have been possible. That's the potential of digital care and digital navigation. There's also this concept of digital therapeutics and digital monitoring that started to become mainstream. And WellDoc was the first digital therapeutics and digital monitoring app which was approved by FDA. And the reason it was approved, by just closing the loop real time in a patient with diabetes, they were able to show an efficacy equivalent to a $1 billion drug which FDA approved. And the reason they were able to do that was, instead of a glucometer and getting a blood sugar value measured in glucometer, noting down on a paper diary, going to a physician 3 months later, remembering to bring the paper diary, and showing the physician entire diabetes log, which inevitably there were so many steps that it never worked for many patients. We were able to close the loop by just a glucometer which was connected to Bluetooth and connected with the AI cloud, where immediately we could see the sugars were high, and the AI was able to recommend what to do for that patient. And they were able to adjust real time their dietary pattern, their exercise patterns, and medication patterns, what would have taken 3 to 6 months in a traditional world. And by closing the loop by real time digital monitoring, they were able to have an impact which was equivalent to a $1 billion drug that was approved by FDA. So now, not only we can prescribe medicines to our patients or sometimes surgery, we can actually prescribe apps to our patient that can be with them at every single day, guiding them Another example of digital care. We're gonna expect the digital therapeutics, digital monitoring, digital care is gonna increase exponentially in the next few years. We expect by year 2025, more than double the US population will actually be using digital therapeutics day to day to help them in their care. And some things, and just I'm a gastroenterologist, I want to share a GI example as well. And we can take all the rules of all what has been in our literature and we can demystify them and bring it to the patients in a manner they want to be brought. And I'll share the example of colonoscopy. Colonoscopy is advised for every patient above 45 years of age, and it has been shown to decrease the risk for colon cancer later on in the life. However, it's a very expensive procedure, but in spite of it being expensive and approved by the insurance company, only 1 in 4 patients actually prepare enough for the colonoscopy and it is successful. And the reason for such a high failure rate, up to 25%, is because the science is there, but the delivery of care will lag behind. Often we as a gastroenterologist give a paper to the patient and say, hey, read this paper and that will help you prepare for a colonoscopy 3 months to 6 months down the line. And when we did studies, we found 1 in 4 patients actually forget where they kept the paper by the time they reach back home from the clinic. Another 25% people forget how to find the paper when the time for colonoscopy comes. So people have no idea how to prepare for colonoscopy. Another significant, up to half of the patients, even if they have the paper, they cannot understand it enough and they cannot activate the right things at the right time. There are at least 10 steps that people have to do in a time-dependent fashion that they do not recall how to do it. This is an example of the paper instructions we gave, that state of the art till now. So when we realized there's so many steps that were the gap in digital care, we were able to quickly change it into a text-based program, very much like what was done in Australia for cardiac diseases. We were able to give specific instructions to the patient based on what they need to do on that given day, starting with a video on why it's important to prepare, then how to prepare, how to mix the medicine, how to avoid the very high fiber diet, and really driving direction and parking directions in the end. And at any time when a patient was not able to understand, they just have to press 1 in a text message and it connects real time to a nurse or a nurse assistant for a chat and guiding them. So we were able to take the entire journey of the patient and we were able to activate them about their procedure, have an appointment right on their smartphone, all the preparation, instruction and video, as well as driving direction and parking direction, completely seamless for them. It's like a physician is there with them at every single step of the way. And anytime a person is not able to get, we were able to track all the patients, who was able to click through it, who was able to understand instruction, and which person needs the guidance with a backup of a human navigator. And we were able to show that if we are able to achieve this automated digital navigation, there was a 4 times higher success rate of people who are engaged in completing the procedure versus people who could not complete the procedure. As this graph shows, the most important predictor of a success of colonoscopy was not age, race, gender, or anything else, except how they have been able to engage with this digital program. We've also been able to show that we were able to save $1 to $2 million of inefficiency per health system, leading to $50 billion savings if we are able to replicate this model across the US. So looking at all these digital care programs, all this digital automation, we also need to bring it together so physicians, clinicians, nurses can actually prescribe it in a very seamless manner. So we came with the concept of a digital health formulary. So we are able to bring, very much like we can bring a drug formulary to a physician to be able to prescribe from electronic medical records. We can now prescribe this digital front door, this digital navigation, and this digital therapeutics and monitoring right from this unified system and really create a new way of delivering digital care that has never been possible before. We have been able to now build on that success, Not only if we just tell a person to download an app, it was a 6% success rate because they would forget the name. They will not struggle to find the right kind of spelling in the app store and buried among 450,000 health apps and 4.5 million other apps. And then they will forget their iTunes password to actually making it seamless for them. And we were able to increase the activation rate from 6% to 92%. People clicking on the instructions that is given to them. And we able to track electronically, which we have never been able to track on a paper-based world. We were able to show for monitoring patients who were getting discharged with something like heart failure and 30% people coming back within a month because we were able to control them in the hospital, but the moment they go back home, they were not monitored that closely. We were able to decrease that readmission rate by 40% by aggressively monitoring them through a Bluetooth connected blood pressure and a weighing scale, and the data coming back real time every single day. We were able to then prescribe the digital navigation program I mentioned for colonoscopy in partnership with American Gastroenterology Association, and led to what I mentioned, $1 million savings for an average hospital and a 50% reduction in aborted procedures and 4 times more completion rate of colonoscopy. We were able to now replicate this across surgical specialties as well. And we believe no single service line in healthcare, no single clinician, no single researcher, and no single patient can get left behind in taking advantage of this automation and self-service capability. We were able to show we can improve the outcomes among patients getting joint replacement. But we can also use the same technologies for recruiting patients into clinical trial and advancing research. We can reach out to all those patients and automatically through bot really engage them and actually get them into clinical trials. What was really a very labor-intensive one-to-one process, we are able to convert that into one-to-many process. And I'll share the example of what we did during the COVID pandemic when I was part in New York City and right in the middle of the pandemic in New York City in April last year. We really started getting a lot of requests, a lot of phone calls from patients if they were having any minor symptoms or others, and asking questions because there was so much confusion in the media what needs to be happening at that time. We had all our phone call system clogged. We did not have enough people to man them. So we had to resort to one-to-many technology so we can answer this for the patients. We were quickly able to create a bot which will replicate the same thing what we'll tell as clinicians to the patient, which will seamlessly guide them where they are in the process and actually can guide them whether they need to come in the hospital or they can manage themselves at home. We were also able to enroll them into a clinical trial program. By connecting with electronic health record, we were able to reach out to 1 million patients within 8 weeks, and 55,000 people we were able to enroll into a regular monitoring program. This was without a single in-person coordinator. If we had to do that in a traditional world, we have required an army of more than 100 to 200 coordinators, which we did not have any capacity at that time. So that's how we have been able to extend and scale, going from the science of medicine to delivery of care or delivery of research using this automation in digital care, which has just been amazing to us during the COVID times. We know we are able to now increase this adoption of digital therapeutics, digital monitoring, and digital care worldwide exponentially in an exponential manner. But there are major challenges which are preventing us right now to achieve this level of growth, which we all need in society. And the number one gap which we need to address is this lack of evidence generation. There is so much going on in technology these days. And the screenshot, what you see right now, shows just how much fragmented digital health it is. We can't even count today the number of startups, the number of technologies, the number of point and click solutions for every single disease that are there in the App Store today. And if you add them to automation and AI algorithms, if you add all those IoT and the sensors, it's even more mind-boggling. But the challenge is this is creating a problem of plenty, right? Because we as health system, we as clinicians, we need a very simple way to digest the best solutions and make it available to patients through a formulary. But we have no way of finding which is the best solution because many solutions are never tested, right? We believe in healthcare. We need to have the burden of proof being explained for new technologies. What we do not want is another example of Theranos, right? We just trust the technology and we trust the money that is being raised and blindly follow that. And too late we realize that this is not the trusted technology and we lose the faith of the patients and the scientific evidence. So we need to build evidence right from the very beginning of any new healthcare technology, very much like we have phase 1 to phase 4 trials in medications and devices. We need to set up an ecosystem where we can have individual trial testing and then limited pilot testing, then large scale testing before it is universally adoptable, that technology. So I'm very fortunate to be part of Node Health, a network of digital evidence in health, a non-profit association which is bringing all the key players from the government to the health system to health plans to industry and startups together so we can actually together address this problem of lack of evidence by doing multi-centric clinical trials. And really what we want to do is take all the innovation in digital care that's happening today that has a potential to really change healthcare forever and really combine them with the rigor of evidence-based medicine that has been taught in our medical school since long. So we don't have to lose track of that evidence. We just really need to combine those innovation with rigor, really create evidence-based digital medicine. Technology that we can all trust. Technology which we can all trust to prescribe to our patients, prescribe to our family members, prescribe to our friends. The second major challenge in this ecosystem is the lack of equitable transformation. And what I mean by equitable transformation is that no patient gets left behind, no matter what their understanding level is, no matter what access to technology it is, no matter whether they can use smartphone or not, whether they have broadband or not. And that's a major challenge that we have to address. And one of our goals at UC Davis is, without addressing that digital health equity gap, we will not be able to lead nationally in a digital first vision. So our goal is really to create a digital Davis experience for everyone, no matter what they have access to technology or not, and bring all the technologies together under one belt for that patient and really scale them like they have never been scaled before. I just want to give few examples how big the gap in this equity gap is there currently in our society. What you're seeing in this slide is the enormous gap that exists in healthcare today. Citing the example from Cleveland and Cuyahoga County, just a 30 miles difference in the area from inner city Cleveland to the suburbs of Cleveland, there's a 23-year disparity in life expectancy. And that is something that we have to fill the gap in. But what is really bothersome, if you look at the graph on the right side, that gap in the life expectancy completely mirrors the percentage of people living in poverty, right? So that's what we call as a social determinants of health. In fact, no matter how much we advance in science, even in delivery of care on a medical side, if we don't address lack of access to right kind of food, to right kind of transportation, and right kind of access to technologies, we will not be able to bridge this gap just by science alone, right? And that gap, which we see in health equity, there's a risk of that actually being furthered if we don't pay attention to it. And this study actually shows the gap, which once we moved during COVID times to in-person care to a video visits, we were able to see that the gap further widened because people who had more access to technology were readily able to get access to video visits. And so if you see the graph on the left side, people who were above 65, people who were non-English language, people who were non-Medicare, and people who were in Medicaid actually had much more bigger gap in accessing telemedicine than otherwise, right? So we actually are at a very important moment where we can bring on more and more technology, but if we don't do it in a very intentional and thoughtful manner, we can actually keep on increasing the digital divide. Another way to see it is to see the broadband access, which is on the right side, the percentage. Is such an enormous difference between white, black, and Hispanics. And there's also similar difference in access to owning a phone and subscribing to broadband. So how can we, in healthcare, change this widening digital divide to actually creating a digital bridge? And this slide is from my colleague Amy Schuen, which is part of the Node Health, is how we can really look at digital equity as a super social determinants of health. If smartphone and digital technology are conduit to delivering the care, and they will become the dominant conduit of delivering care, whether it's video visit or one-to-many digital care, then lack of smartphone and lack of broadband will be the single most important barrier to access health and healthcare. So we really have to fundamentally solve it by looking at a multi-pronged strategy. And we did some study on that. We find it's not just we have to address the connectivity and the broadband gap. It's not just the lack of the smartphone access. It's actually a lot of training for skills. We never train our patients to use the smartphone effectively for their healthcare. We just start presuming that they will know, right? And that's where we need to create courses and curriculum and initiatives and programs to really aggressively address and really make a digital divide to a digital bridge. But we cannot do it alone. We require a bigger ecosystem, and that's where AWS and Amazon comes in. And with that, I'll pass on to Sue to take it from here.
Thank you, Dr. Treja. UC Davis Health is definitely a strategic partner for AWS, and we are very excited to be working with you and your team. Throughout our reInvent, you will all be hearing that Amazon is arguably the most customer-centric company in the world. Our founder, Jeff Bezos, has built Amazon on 3 big ideas, and we have stuck by those ideas for the past 20 plus years. We put the customer first. We invent on behalf of our customers, and we are patient with the outcome. Our point of view at Amazon is, if we remain obsessed with our customers, really understand them and their business as well as they do, and innovate in collaboration with our customers, then the business will take care of itself. And this is exactly the kind of partnership we have with UC Davis Health. As Ashish mentioned, they do not want to leave any patient behind. And at AWS, we strive not to leave any of our customers behind. Customer obsession remains a focus on how we work with organizations across the spectrum of care, which includes healthcare providers focused at the point of care, healthcare ministries that create healthcare policies impacting populations, healthcare payers that finance or reimburse the cost of care, and medical devices that provide application-specific solutions throughout the healthcare industry. Now you might be wondering, how does AWS fit into all of this? Well, AWS provides the foundational technology to drive security, compliance, agility, and innovation. Our focus on technology solutions allows the entire healthcare industry to worry less about the undifferentiated value of commodity IT and focus more on what really matters. The answer is simple. What really matters to you is your patients. AWS provides you with a trusted platform where you can unlock the potential of healthcare data, and we provide the technology and tools needed to enable interoperability that can streamline the structured data exchange needed to improve preventative and value-based care, patient safety, diagnostics, predictions, cost reductions, care quality, and even the clinical research. I also want to talk about our amazing and rich healthcare partner network. As Dr. Treja mentioned, No single company or organization has the capability to transform healthcare alone. AWS has a thriving partner network of global innovators that have deep domain expertise to support healthcare providers and payers. I just shared an overview of how AWS can help the healthcare industry. With the breadth and depth of the solutions built with thousands of customers globally, we listen, learn, and understand your business. In addition to being the industry's most comprehensive and broadly adopted cloud platform, we have over 8 years of experience with a specific focus on healthcare and life sciences industry. What do I mean by focus on healthcare and life sciences industry? Well, let me give you some examples of what I really mean by that. Our team is made up of chief digital officers, nurses, physicians, chief medical officers, neuroscientists, biochemists, professors, radiologists, researchers, and our beloved solution architects, and even the first health information officer for the FDA. This combination of technology expertise and industry knowledge has made AWS the trusted technology partner for the entire global healthcare industry. I already touched upon this a little bit earlier, but I want to specifically call this out again as it is very important. At AWS, security and privacy remains job zero. Specifically for the healthcare industry, we provide a number of global certifications and accreditations like HIPAA, HITRUST, GDPR, and many others that allow customers to store, process, or transmit their most sensitive data in the cloud and improve their security and compliance posture. Most importantly, a shared responsibility model ensures that the ownership and control of the data always remains with the customer at all times. Dr. Atreja explained the challenges around healthcare and the importance of digital care. As we look across the journey to digitally enhanced healthcare, at AWS we group the transformation into three categories: IT cloud transformation, predicting healthcare relevant events, and personalizing the healthcare experiences. The adoption of cloud technology has been increasing at a frantic pace. There are quite a few drivers for this change, but much of it comes down to simple analysis of the costs and benefits of cloud infrastructure. If you take the behavioral healthcare organizations as an example, cloud computing solutions can frequently provide better levels of service as compared to their internal IT efforts. Part of this has to do with scale, obviously, but much of it has to do with the investment in personnel. What's the personnel? That's the people, technology, the rigorous processes, and the expertise that cloud providers can bring to health IT. I mentioned we have thousands of healthcare customers, and some of the key benefits for the cloud that we've heard from our customers in healthcare include scalability and flexibility of data storage, cost, security and reliability, and collaboration to accelerate innovation, which is critical today in the healthcare field. We have over 100,000 healthcare customers who use AWS, and I would like to share some examples of healthcare customers with you to give you insights into some of the innovation we've done with them. Many of you already know Change Healthcare. It is the largest provider of administrative services for the US healthcare industry. It's based in Nashville, Tennessee. Change Healthcare processes claims, pharmacy requests, and performs other functions for more than 340,000 physicians and 60,000 pharmacies. By using AWS, Change Healthcare can now develop and test new services for its customers quickly, and it can scale to meet large demand while minimizing IT costs and complexity. The vice president of their IT business services said that by using AWS services, They expect to reduce their overall data center footprint by around, wait for it, 80% over the next couple of years. 80% is pretty significant. Congratulations to the entire Change Healthcare team. Well done. You might all know Cerner as well. Cerner should be no stranger to you if you are in the healthcare industry. Cerner is one of the leading suppliers of health information technology solutions and has been able to create population health level tools with AWS. One of them being Health Intent, which is a large-scale platform to normalize data using AWS services. Cerner was able to take data from 240 million Americans and exposed it to tools for machine learning and incorporation of standardized knowledge. They then used that insight to derive more insights from the data in a very efficient way. In 2019, Cerner named AWS its preferred cloud and machine learning provider. Again, good job to the Cerner team. As seen from some of our examples, over the past decade, we have witnessed some digital transformation momentum in healthcare, with organizations capturing huge volumes of patient information every day. But this data is often unstructured, with information trapped in lab reports, insurance claims, clinical studies, recorded conversations, x-rays, doctor's notes, and many more. You know that. You've had personal experience in this if you are in the healthcare industry. The process to extract this information is labor intensive and error prone. Also, the cost and operational complexity is a challenge for most healthcare organizations. Every healthcare provider, payer, and life sciences company is trying to solve the problem of structuring the data. Because if you do, you can make better patient support decisions, design better clinical trials, operate more efficiently, and identify population health trends. To help with this unstructured data challenge, we at AWS have introduced Amazon Health Lake. So, what is Amazon Health Lake? Amazon Health Lake is a HIPAA-eligible service that allows health insurance companies, pharmaceuticals, and healthcare providers to store, transform, query, and analyze large amounts of healthcare data at petabyte scale. HealthLake provides key features and functionality from the initial import of data to tag and index to transform, search, analyze, so you can finally ask the right questions and uncover new insights. This really helps us make sense of the healthcare data. And going back to what Dr. Trager spoke about, the first challenge in healthcare, it helps us get the evidence. Dr. Trager spoke about the lack of health equity, and in order to help innovate and find solutions to address this, AWS has launched a new health equity initiative. Addressing health inequities requires a multifaceted approach and a variety of solutions due to its complexities. We just discussed many of those in this session. Though technology is not a silver bullet, it is not. It can be a force multiplier for organizations building innovative cloud-based solutions to remove barriers and reduce disparities in health. The benefits offered by this program is to support innovation by customers like UC Davis Health who are building solutions to advance health equity. Through this initiative, AWS is committing to $40 million over a 3-year period to help find solutions to overcome health equity challenges. The deadline for this year was the 15th of November 2021. Hey, but don't worry. As I said, this is a 3-year initiative and we will accept applications till 2024 in March, June, on November of each year. To take this event even further, we at AWS have joined forces with UC Davis Health on a very special partnership to launch a Cloud Innovation Center focused on digital health equity. Now, Dr. Ashish will take over to give you more details about this partnership and the Cloud Innovation Center.
Thank you so much, Sue. We are just incredibly excited about this partnership with AWS to really address digital health equity in a largest scale possible globally. So, our mission with this Cloud Innovation Center, the first in the United States in a healthcare setting, is really to address the biggest challenges around digital health equity so that no patient, no clinician, no health system, no health plan, no pharma gets left behind in digital health transformation. And this is completely aligned with the vision and mission, the values, and the patient promise that we have done for UC Davis Health, the UC system, and many of our partnering health systems. We went through a very big strategic initiative, and the goal was to deliver the next generation of care, the next innovation, and next cure. And we published in NHM Catalyst, our CEO, Dr. Lubarsky, on how, as an academic medical center, we need to complete but not compete in care. How we need to set up a regional center of excellence, which partners with all other health systems, all other care providers, all other entities as well, to really bring healthcare to a holistic manner. And patients are at the center of everything we do. So we've established an entity called Digital CoLab, completely focused to create a global ecosystem for collaboration, for innovation and validation, and boldly drive digital health innovations to make the healthcare more accessible, people-centered, and equitable. And we are also very fortunate to partner with the city of Sacramento to actually have a physical space where we'll be validating digital technologies as well as providing large-scale transformation pathways right at the heart of the Sacramento and Central Valley. We believe what Silicon Valley has done for technology, we, partnering with others, can do the same at Central Valley for digital health, validation, and transformation. And at the center of that will be the patient experience center and a patient usability center, where we'll invite patients to come over and the caregivers and the family to test out different technologies, to create kind of a digital sandbox and really see what is working, what is not working before investment is done, before they are brought to actual patient care. And we want to create a very open innovation ecosystem where anyone and everyone can partner, right? We can start as much as we can co-ideate common set of solutions if we find bigger challenges. But we can also co-create solutions with other health entities who may have an idea and may have started the journey. But really, if there are startups out there or even established companies which have built solutions, we can validate those solutions to be sure they are ready to be brought to the patient care, and actually how to do the implementation science that they can really get the value from the technology that's there. But once we prove this technology works in a limited manner, how can we create frameworks so it can lead to largest transformation ever? So we scale the technologies not only within our health system, but we also go beyond our health system to the entire University of California health system, but also beyond University of California health system to our global partners. And really we see it as a two-way learning between Amazon and AWS and the Digital CoLab and UC system. Instead of being slow and defensive and working solo with the blinders on and not seeing anyone, which is traditional healthcare, we want to completely take our blinders off, completely take our biases off, and really do a rigorous testing in a sandbox collaboratively. Instead of thinking about what technology can do, we want to package all the technology in a digital health formulary, these bots, chatbots, and others, after we test them, and bring really right to the hands of the physicians and actually empower physicians, clinicians, nurses to prescribe tools to provide one-to-many care. Instead of having other startup companies struggling how to engage with health system, we want to create a very open and transparent ecosystem so they can actually engage with us, really to test their technologies and really bring it nationally if that's valid. And we want to really improve that the healthcare is not only getting done in the health system, but really 95%, 99% of healthcare is delivered at home or at nursing homes or at the centers which are outside the typical hospital setting through hospital to home continuum. And we see the entire University of California system, the 5 health systems, as well as all the 20 professional schools, from computer science to biomedical engineering to nursing school, to actually be partners in building new technology, testing new technology, and making California as home to kind of test and validate and then bring it globally. We know at UC System we are one of the largest patents in the world, and we want to really open that technology up for the world as a public university, but really take a mainstream effort in digital health and digital health equity. And expanding from UC System, we already are building ways for a global collaboration ecosystem. We have Cloud Innovation Center partners from AWS, which range around 12 centers, including University of British Columbia, Arizona State University, and others. So we want to build on the work that's already happening in other university instead of reinventing the wheel. But we also have a lot of partners, not only Aggie Square in Sacramento, Node Health, ARC Framework from Sheba in Israel, but we also have started doing a portfolio of companies we believe can take us to the next level and can take technologies to the next level, including AI Doc, which is taking a leadership position in computer vision in radiology, Deadless, which is taking a leadership in how we can do integration of digital health in a very standard-based manner, ML Twist, making some of the ML things really mainstream, and as Milo, which is doing auto ML, which has been spring from UC Davis itself, and Kintsugi, which is creating biomarkers in the space of mental health. Our vision is to combine all those different streams of patient-centered care, provider-centered care through Epic and informatics, operations, virtual care one-to-one, and really help transform to make healthcare more equitable, more accessible, more transparent, more inclusive, more human, and demystify digital health completely. And we really want to work with you, with all of you, to take the current digital divide that's existing, that can actually increase exponentially, very much like we think digital health can increase exponentially, to really convert it into a digital bridge. We clearly have a lot of work ahead of us to ensure digital medicine becomes mainstream medicine. Very much like we have anatomy, physiology, biochemistry, pathology as foundational scientific building blocks of modern day medicine, we need to create a world where we can have virtual care, telehealth, digital monitoring, digital therapeutics, IoT, automation, AI being taught in medical schools and nursing schools as fundamental building blocks of digital medicine. And we need a collaborative ecosystem to do that. We need to bring all the people together who are working in digital health and digital health equity, along with major partnerships in the cloud space with AWS to really address this problem. And what I would urge today, we want to give you the same experience we have started to give our patients through bots, through guiding them. And we want to give you the same experience to be able to engage with the AWS UC Davis Cloud Innovation Center. The same technology like text technologies. So let's take 1 minute out here right now to just text Colab to the number 64722. You can also go to health.ucdavis.edu/Colab and click on the Cloud Innovation Center button. And as soon as you do that, you'll be navigated in an automated manner through a bot, which can guide you to learn more about who you are, the mission and vision of you or your company or organization, and what you want to contribute, and how the Cloud Innovation Center can support and align you into the ecosystem. And we are looking in the next 3 months to build the largest collaborative ecosystem in digital health that's existing ever. And we want you to be a part of it and you to be driving some of the things which we can learn from you. So please do that. Our goal is to get at least 100 queries today, so at least 100 partnership, and then in the first half of 2022, when we formally launched the Cloud Innovation Center, we want to feature you and your work along with what we'll be doing in the challenge in the Cloud Innovation Center. So I'm just taking a little pause so you can complete your engagement and how you want to contribute into the Cloud Innovation Center. And with that, I also want to thank you for meaningfully engaging with us, helping us all become better, and delivering a care like it has never been delivered before. Thank you very much.